Welcome to Issue 2, Volume 28. Our guest this issue is Dr. Erin Hartnett. Dr. Hartnett is a pediatric nurse practitioner and program director of the Oral Health Nursing Education and Practice Program at the New York University College of Nursing. Her topic, Building a Culture of Collaboration, Nursing and Dentistry.
Hello, I'm Erin Hartnett. I'm a pediatric nurse practitioner and director for NYU College of Nursing's Oral Health Program. And I'm very happy to be here today to fill you in on what the nursing profession is doing to promote oral health. We've had so many important reports in the last decade that have pointed out that oral health is a serious problem for children with many health disparities, a lack of access to care. Yet this major public health problem and its relation to overall health has virtually gone unnoticed in the professional education and practice of physicians, nurse practitioners, nurse midwives, physician assistants, pharmacists, the most likely health professionals who could really play a leadership role in advancing patient-centered care. But nursing's trying to change that. So how can nursing help? Well, first of all, we're the largest workforce of health professionals in the nation. With over 3 million RNs, 158,000 nurse practitioners, and 12,000 nurse midwives, we can really play a significant role in both expanding access to oral health care and decreasing the disparities in oral health care. Because nurses are everywhere. We're in schools, hospitals, offices, camps, home care, retail clinics. In the past, oral health care was not a high nursing priority. A series of surveys of nurse practitioners showed that most didn't even see it as their responsibility. There was a general negative attitude found in the nursing professionals regarding oral health, especially in elderly, and the education of nurses about oral health has been reported as inadequate or inconsistent. But today there's a nationwide movement to increase nursing awareness, knowledge, and skill in oral health, and the significance that oral health has to one's general health. First, let me explain what a nurse practitioner is. There are 5 different kinds of nurse practitioners: neonatal, pediatric, family, mental health, and geriatric. In addition, there are nurse midwives. All of those are called advanced practice nurses, and they are all considered primary care providers. They can see patients independently, perform histories, physicals, lab tests, diagnose, and treat both acute and chronic conditions. Now, advanced practice nurses, which are the nurse practitioners and nurse midwives, they really emphasize health promotion, disease prevention, and they focus on the health of the individuals in the context of family and community. They often practice in rural areas and health profession shortage areas, and so they can play a significant role in increasing the quality of oral health care and the access to oral health care if they have appropriate education and training. So that's where the focus is today. Many nursing programs and continuing ed programs are including a stronger curricula about oral health. For example, we have changed our traditional HEENT exam to the HENOT exam, which means that our students cannot omit the oral exam. When they're performing their physical assessments, they must include the oral cavity as part of their exam. So we have put the mouth back into the head. And what are we teaching them to look for? First of all, we're teaching them to recognize what are the risks for oral disease through competent oral exam, and to provide patients with basic oral health information, and to integrate oral health information with both their diet and lifestyle counseling, and to make and track referrals to dental professionals. So all of these things are being integrated into our curriculum. At NYU, we have been very lucky because 8 years ago, the College of Dentistry and the College of Nursing at NYU made a landmark decision to create a formal partnership, and this provided a unique opportunity for collaboration, research, education, and service learning. This interprofessional partnership has become one of the national models for influencing interprofessional initiatives in education, research, and practice that advance oral health and its relation to overall health. And it provided us with an opportunity to pilot several interprofessional initiatives to capitalize on the oral systemic connection. In addition to this, the NYU College of Nursing has 2 oral health grants: the Oral Health Nursing Education and Practice Program, which is funded by DentaQuest, the Connecticut Health Foundation, and Washington Dental Service, and TOSH, the Teaching Oral Systemic Health, which is funded by HRSA. So our unique relationship with the dental school and our 2 grants have given us a unique opportunity to make a lot of changes in nursing and oral health. First, we've changed our curriculum. So we have started faculty and preceptor development workshops, because if the faculty doesn't know it, they certainly can't teach it. And then we've woven oral health into our curriculum. We didn't start a new course on oral health. We're making sure that whenever our faculty, whatever they're teaching, they integrate oral health into it. And so now it's in all of our core courses and our diagnosis and management courses. For example, if the pediatric nurse practitioner students are learning about celiac disease, then they learn the oral manifestations of celiac disease. We're also taking this curriculum nationwide so that we can expand it to all of the nursing programs in the country. The second thing we're doing is developing best practices. We have a nursing faculty practice which is located in the dental school. So this has turned out to be a wonderful collaboration between the dental school and the nursing school, because any patients that are seen in the dental clinic now have access to primary care providers. And then any patients who are seen in the nurse practitioner faculty practice also have access to dental care. And we share our students as well. Students in the nurse practitioner faculty practice go and spend time in the dental clinic. So they're learning the oral assessment, and then they're providing assistance in terms of the medical care for these patients. We've also developed, in terms of best practices, a relationship with the Nursing Family Partnership. The Nurse Family Partnership is a group of home care nurses, and this is a nationwide program. These nurses go into the homes of first-time high-risk mothers, and they see the moms and the babies from pregnancy through 2 years of age. So we've developed an oral health education program for these nurses so that they know how to educate both the mothers and babies on the importance of oral health and prevent oral disease. We've also had a lot of interprofessional education clinical experiences. Our pediatric nurse practitioners go out with the dental students to the Head Start locations, and they are learning the oral health assessment, and they're helping in terms of behavioral management. We've also had interprofessional programs where we've not only included nursing and dentistry, but we have the medical students. This past fall, we had a program with 400 students, medical, dental, and nursing, in our simulation lab with standardized patients. And that was so well received that we're repeating it again this fall. In April, we are beginning a program with medical, dental, and nursing students working together in teams in the Bellevue Pediatric Dental Clinic. So we have a lot of programs going on at NYU, but we're also aware of many other colleges and universities, at least about 24 of them, who are integrating oral health into their nursing curriculum, and about 20 different clinical programs that have interprofessional oral health experiences. So far, we haven't collected any data on our graduates, but we've been collecting data on our students with pre- and post surveys before their interprofessional experiences, and we've found that we're really seeing an increase in attitudes towards interprofessional communication, collaboration, roles and responsibilities, and team functioning have been showing a positive increase after their oral health clinical interprofessional experiences. Just wanted to let you know that nursing is ready, willing, and able to join the fight against oral disease. We want you to know we're on your team. We're not trying to take your patients. We just want to make sure that when we see these children, whether as neonatal nurse practitioners, pediatric, family, or mental health, we educate them and their families on oral health. We prevent oral health problems, and we're making sure that they have a dental home to see you at an early age. Okay, thank you for listening.